decision to allow it in a limited capacity. But what is stem cell research? Dr. J. Ricardo Loret de Mola is from University Hospitals, and he's the head of the Reproductive Endocrinology and Infertility Division. Thank you so much for being here.
Thanks for inviting me.
You said, you were just telling me a few minutes ago, that you've gotten a lot of phone calls from concerned patients who have gone through in vitro fertilization treatment, and they may have embryos stored at university hospitals. What have they been saying to you?
Well, a lot of patients are concerned about the future of their embryos. They think that the green light that President Bush gave for stem cell research means that we're going to start using their embryos for research purposes. And the fact that's not the case. All our patients do not need to be concerned about the use of their embryos for those purposes. It's very clear that the embryo research that will be approved has to do with embryos that already had cell lines derived from, and they're already, you know, used and done for those purposes, and that they would not approve any new embryo to be used for these purposes. So.
And President Bush approved funding for 60 existing stem cell lines. And I've heard some criticism this past week that that doesn't provide a lot of research area. Is that true? Do you think it's going to be limited, or do you think that does give a good start to the research?
I think it's a great start. We must remember that these are total potent cells. In other words, these cells have the ability to turn into any type of cell or any type of tissue. 60 of them should provide plenty of room for investigators to work on.
And there are so many areas that these could be used in. What are some of the diseases that they're going to be looking into and seeing where these stem cells can actually help treat?
Well, because these are cells that could be turned into any type of tissue. They could be turned into brain-type cells, for example, for Alzheimer's disease. They could be turned into pancreas-type cells to be able to be used for diabetes work. They could be turned into skin cells for burn victims.
So a lot of different options.
Difference, yes.
And I'm sure we're going to be hearing much more about this. Thank you so much for coming on and talking about this very complicated subject.
It is.
Okay, thank you. Jeff?
Thank you.
And still to come for you this Sunday morning.